Good morning. We are convening our Committee on Pandemic and Disaster Preparedness hearing on Thursday, 24th at 11 a.m. We're gonna start off with HCR 35, HR 30. First up, we have Haima.
Good morning, Chair, Vice Chair. My name is Luke Myers, the Administrator of the Hawaii Emergency Management Agency. HIEMA stands on our written testimony offering comments on this concurrent resolution. We do know that there was a similar resolution from the previous session that talked about volcanic-related threats on the Big Island and developing plans. We had provided an update of that before session, obviously due to the pandemic and a number of other stretch resources. We hadn't made as much progress on the last resolution related due out. So we continue to work with the partners, specifically civil defense on the Big Island and the park with regards to the intent. Available for discussion as necessary. Thank you so much.
Thank you, Luke. Okay, we have a number of individuals that submitted testimony in support. Is there anyone else wanting to testify on this resolution? No? Okay. We will move on to HCR 67. First up, we have Department of Human Services.
Aloha, chairs, members of the committee. I'm Judy Moore Peterson. I'm the MedQuest administrator with the Department of Human Services. And on behalf of the Department of Human Services, we stand on our written comments. We very definitely appreciate the intent. We just want to note that we're happy and willing to work with many different community partners on this very important topic throughout the state.
Thank you. Next, we have Stonewall Caucus of the Democratic Party of Hawaii. Okay, next we have YMCA of Honolulu.
Aloha, chairs and committee members. My name is Greg Weibel. I'm the CEO of the YMCA, testifying in support of HCR 67. Mental health experts from across the country are expressing a very high level of concern that we are in a pandemic of mental health problems with not enough resources and approaches to help people. The voice of people who are seeking help include feelings of being stuck, empty, uncertain, anxious, overwhelmed, burned out, stressed, isolated, and depressed. The last couple of years have had significant negative impact on people's wellness, including mental health. The surveyed mental health professionals think the state and federal government must provide more resources. Unfortunately, the situation for our youth is so very sad. In early 2021, emergency room visits for suicide attempts shot up 51% for adolescent girls and 4% for adolescent boys compared to the same time period in 2019. Mental health providers and school systems cannot do this alone. They are at their capacity. And not all kids' mental wellness challenges rise to the level of a clinical disorder or severe functional impairment where they need treatment through the mental health clinicians. There are many youth that can benefit through strategies and tools, including teaching skills around self-care, life skills like communication, stress management, and coping skills. For decades, the Y has been providing supportive services to thousands of youth who have been dealing with substance abuse, as well as all kids in every situation in our community. We understand assessment and treatment models and working in age-appropriate approaches. And we will be partnering with licensed clinicians to help guide our mental wellness programs. So we're advocating that departments of health and human services spend time working with us on a plan to help improve the mental wellness of our youth. Mahalo.
Mahalo. Okay, we have two individuals that submitted testimony in support. Is there anyone else wanting to give testimony? Okay, there's no one else to testify, so we are going to recess. Oh, but do you have any questions? Members, any questions? Comments?
I have a quick question.
Go ahead.
for YMCA, Mr. Weibel. Thanks
Yes.
so much for being here this morning. Nice to see you, and thank you for this resolution. I agree that mental health, especially for our youth in the state, is a concern. I noted that in the resolution, it talks about the YMCA of Honolulu is working to support the mental wellness of the state's youth. So I just wanted to clarify, are your programs going to be statewide or Oahu only?
Yeah, what we would propose is we would do a statewide program. We would work with either the YMCA's on the other islands or deliver on their behalf.
And are there specific programs that you wanted to partner with Department of Health and Department of Human Services on?
Yeah, so we want to talk with them about the development of programs. We have a program design that we're ready to go with. And so we'd love to talk to them about our proposed program.
Could you tell us what the name of the program is?
We haven't named it yet, so we're still working on that.
Oh, okay, okay. But your plan is it would be statewide.
Correct.
Okay, got it. Thank you for the clarification. Thank you.
You're welcome. Thank you.
Any other questions, members? No? Okay, we are going to recess for decision making. Okay, we're back for decision making on our resolution. Sorry, Chair, should give you this. Okay, so first for HCR 35, HR 30, recommendation is to pass as is. Members, any questions, comments, concerns? Okay, Chair.
We are voting on HCR 35 and HR 30. Recommendation is to pass both as is. Chair, Vice Chair vote aye. Rep. Costales? Aye. Rep. McKelvey is excused. Rep. Mizuno excused. Rep. Wildberg excused. Rep. Woodson?
Aye.
Rep. Yamashita?
Aye.
Rep. Ward?
Aye.
Chair, the recommendation is adopted.
Thank you. Next, we have HCR 67. Recommendation is to also pass as is. Members, any questions or comments? Seeing none. Chair.
Okay, recommendation is to pass HCR 67 as is, noting reps McKelvey, Mizuno, Wildberger excused. Any reservations or no's? Seeing none, recommendation is adopted.
Thank you, members, and we are done with this hearing.